All right, thank you all so much. First of all, it's so good to be back with you all on this Tuesday. As you all know, that we've been doing these Facebook Lives for the past about 4 or 5 weeks, and I'm very appreciative for the response and the love that we've gotten for individuals who tune in for information. From Senator Marco Rubio, who came on last week to give us a outlook on how we're looking nationally when it comes to the second stimulus package that's coming out or has come out, excuse me, to now to a conversation that many of you have inboxed me messages and asked if it was possible for us to have a conversation around the topic of criminal justice reform. This is a discussion that I know for a fact that it has taken on national attention to how we deal with a vulnerable population of individuals, and we have some amazing people to have this conversation with today. Who I'm going to allow them to introduce themselves in a few minutes. But as we start off often, we always give an update of where we currently stand as a state with our cases. Currently now in Florida, we are up to over 37,000 cases with about 6,000 hospital admissions. Broward County, we have 5,000 cases with about 1,000 hospital admissions. In Miami-Dade County, we have 13,000 cases with about 1,700 hospital admissions. We're going to start giving the update of individuals who actually survived, because I think that is also important for individuals who actually recover from COVID-19. But the biggest thing that we're here for today is because we know for a fact that we have a population of individuals who are incarcerated. We want to continue to ensure that although they are incarcerated, to ensure that their dignity is being maintained and that their safety is being upheld. And so today we have a few people who are knowledgeable of what's happening within our criminal justice system, whether pre or post COVID or current COVID, and who are on this conversation. And for the next hour, we're going to have a conversation as friends and as residents here in the state of Florida, and individuals, constituents within our various communities, to talk about criminal justice in the age of COVID-19. We have our very own Broward Sheriff Gregory Tony, who is one of our speakers today. We have Desmond Meade, the Florida Rights Restoration Coalition number one person who traveled this state to get Amendment 4 on the ballot. We have Rodney Jacobs, Associate Director of the Civilian Investigative Panel. We have Chelsea Murphy, Florida State Director at Right on Crime. And we have Dr. Terri Watson, who is an Associate Professor of Leadership and Human Development at the City College of New York, and used to be my boss at FAU High School. And she left me there by myself, but she's very knowledgeable in this area. So I'm happy. I'm glad to know each of you, but I'm even happier that all of you are on this, each of you that's on this panel are extremely knowledgeable on the topic when it comes to our criminal justice system. But knowing that we have fighters for our criminal justice system on this call, on this Zoom, I also know that we now have an added problem on top of the system that's in need of fixing, and that's COVID-19. So we have 1 hour with each other, and I want to pump as much information out to people as possible. So let's go ahead and get to it. So I'm going to allow each of you to, if you could spend about 1 to 2 minutes to introduce yourself and share where you fit into this conversation. And then I will then come around and ask for some information about your role in all of this. So we'll start with you, Sheriff. Just about 1 to 2 minutes to introduce yourself and share where you fit into this conversation in criminal justice reform, and criminal justice in the age of COVID-19. All you.
Thank you, Shevrin, and thank the panel for allowing me to join. And there's a lot of top-notch players on this panel, so I think this conversation will be pretty good. Of course, I'm the sheriff of Broward County. I was appointed a little over 15 months ago, being the first African-American sheriff in the history of this organization. For those who are not familiar with the scale and size and what this agency does, I currently have roughly 5,700 employees under my command. Roughly 3,000 of them fall into the capacity of first responders. The Broward Sheriff's Office is somewhat unique in that we are maybe one of two different entities in the United States, where we also have fire rescue under my responsibility, where roughly 700 to 800 or so personnel fall in that group. I would say this, in terms of what my role would be in terms of criminal justice reform, we as law enforcement officers are the gatekeepers. We control the influx of personnel that comes in, and we also have an ability to impact those who actually come out. And in addition to the capacities that we have in terms of personnel, the Broward Sheriff's Office is also responsible for the jails here in Broward County. And so we have a multitude of responsibilities that 100% is involved and should be into this panel in terms of discussions, because the things that we do from both an operating standpoint as well as initiatives that I may put forth from a policy standpoint. Chev, we'll talk more about some different things we've done in the past. It's vital that I be here because I am truly the gatekeeper at this point for the county.
Thank you so much, Sheriff. Desmond?
Looks like we lost Desmond, Chef, for the moment.
Okay, no problem. Well, we take it to you, Rodney.
Hey, everyone. Good to be here. And Chef, thanks for having me a part of this conversation. I'm really excited. In my capacity and a little bit some of my background, I'm a commissioned officer in the United States Army, did law school, public health master's, as well as public administration. Currently, I'm working with the city of Miami in our civilian oversight department of the city of Miami Police. I guess my role or how I fit into this conversation is really just understanding policing in our more modern era and how we can work collaboratively to ensure that our police department is maintaining safety for the people that maybe you're arresting or helping or influencing. Public health aspect of it is each and every day. And for a lot of the innovation that police departments deal with, it's always
I don't have it
on it.
I'm good.
The school to prison pipeline. Do you think there's a lot of things that are missed in innovation when we talk about public health and how we can utilize police departments to bridge that gap?
I appreciate that, Rodney. Thank you so much. Chelsea.
Hey there, I'm Chelsea Murphy. I am the Florida State Director for Right on Crime in the Texas Public Policy Foundation. I'm really excited to be here, so thanks so much for having me. And really kind of how I fit in is I'm a part of the conservative advocacy. And so we're here to kind of, I like to say, give a blanket to some and tell conservatives it's all right. It's not gonna, the sky's not gonna fall. But really we're here, but also, even though we come from a conservative aspect, I think at the end of the day, it's not a right or left issue. It's just about a human issue. So really excited to be here.
And Chelsea, you are an amazing advocate when it comes to it. So it's good to work with you in Tallahassee too. Thank you.
Always a pleasure.
Yes.
I
Desmond.
washed my hair just for you guys.
I appreciate that. You did. I appreciate that, Chelsea. Desmond.
Hey, how you doing there, Senator? I'm Representative Jones. I'm just speaking things into existence, definitely appreciate you inviting me on today. My name is Desmond Meade. I am the Executive Director of Florida Rights Restoration Coalition. And if you haven't heard of us yet, we're the ones that led Amendment 4. And if you haven't heard of Amendment 4, Amendment 4 is the Constitution Amendment that restored voting rights to over 1.4 million Floridians who were convicted of felony offenses but have since served their time and are back out in our community. I think that the role that I'm playing in this conversation is I'm what some folks might consider a subject matter expert. And what that means is that I was once, not too long ago, I was once one of those people that was trapped up in a jail or trapped up in a prison. I was once one of those people that was high on drugs and living in the streets homeless, right? These same vulnerable populations that are getting hit real hard by COVID-19. And so my own personal experience as a formerly homeless, returning citizen, and all of the above, coupled with the work that we're doing now with my organization throughout the state of Florida, is the reason why I'm here. and why I think that I could bring some substance to this conversation. So thank you once again, Senator, for inviting me, and I'm looking forward to participating in this conversation.
Appreciate that, Desmond. Thank you for your advocacy, man. I really, you do some amazing work as you travel the state of Florida.
And then just a shout out to Chelsea, just to let them know Neil said hello. Appreciate the work that you're doing in the conservative community. And it's people like you that's going to help us advance criminal justice reform.
Takes all of us, but I appreciate that. You told Neil I said hi. I feel like I haven't really missed everything social media wise. So, you know.
No, last but not least, Dr. Terri Watson.
You're myself off of mute, and I want to start by I'm honored to be on this esteemed panel, and I am actually a resident of Florida. I split my time between New York and Florida, and as Shevrin alluded to earlier, we first met at Florida Atlantic University, where we were both teachers, and I was quite instrumental into the creation of FAU High School. It's the most aggressive dual enrollment high school in the nation. And I guess what I'd like to add to this conversation is to help us think more deeply and critically about not only how schools oftentimes mirror the prison industrial complex, but as the coronavirus has disproportionately impacted our communities, how does that relate to the schooling of our children? And now that so many of them are home and in their communities being taught by their parents and caretakers, what can we do as we transition back to after the pandemic? Because schools will reopen, and what I'm most concerned about is how we do that thoughtfully, how we do that carefully, and how we don't create the same systems that were in place before. So it's not just about reopening schools, but it's about beginning again and reimagining what schools can and should do. And I'm most concerned with communities of color. And as you know, Miami, Palm Beach, Broward, we have a very large and diverse population of students and people. And as the coronavirus impacted peoples of different races differently, I'm almost, unfortunately sure to bet that schooling will be different for Black kids and white kids and Hispanic kids across the state of Florida. What can we do to minimize those differences and to make sure we educate all children meaningfully and effectively?
Wow. So I appreciate that, Dr. Watson, to all of you all. So I'm looking forward to this conversation. We can let our hair down. This is going to be it's a dialogue that we're going to have with each other. But those of you who are watching, if you could do me a favor, if you can share this on your page, because the conversation that we're about to have when it comes to criminal justice and in the age of COVID, it's such a large topic, and you have the right people here. If you have questions, we won't get to all of them, but you can put your questions down at the bottom, and we will get to your questions as soon as possible. We'll start with the sheriff. And Sheriff, if you can just speak to currently now, I'm sure many people are asking about how we are looking, how are the jails looking, or how you're handling with the jails and the outbreak of COVID to ensure that an outbreak doesn't happen within the jails currently now within Broward County.
Yeah, I will. And there's a two-pronged approach. I'll start with the law enforcement capacity, because people forget that impacts the Department of Detention. And one of the early things when we start seeing the signs and symptoms that this virus was going to start contracting and hitting Broward County and having some significant figures, we wanted to make sure we were not having an influx of increase, bringing people into jail for misdemeanor and small offenses. So I put forth a meeting with all our chiefs of police that represent municipalities here that are not part of the sheriff's office. We came to an agreement to say, hey, this is not the time for us to be making misdemeanor arrests, physical custody, taking someone off the street, let's say for trespassing, or 2.2 grams of marijuana, and then bringing them into a controlled environment with potential of now introducing this virus in a much more expedited pattern. And so you've seen roughly, I think it's running a 30+% decrease in physical arrests that's occurring in the county. We're writing more citations, notice to appears, different juvenile diversionary things that we can do to keep people out of custody. That was step one. That was crucial. When we start looking at the jails, because we were able to introduce that practice in the field, we start seeing our numbers decrease in the overall jail population. So for those who are not familiar, the Broward Sheriff's Office has a bed capacity of over 4,000 inmates that we can house, and the exact figure is 4,276. So we can house up to 4,276. And at the onset of this virus, when it really started coming into the county, I think we were at somewhere about 3,600 different inmates were in custody, and we wanted to see that population decrease. We worked both with the chief judge on some things that we can do in terms of letting people out that were 30 days, from total, time served, so to speak. And we dropped that population capacity down to where it's 64.1%, which means I currently have in custody 2,741 people. We have never seen this department, the Department of Detention, the jails, at that low level capacity. Now, I like that. I like that we're continuing to see a downward spiral of the amount of people that we're bringing into custody. In terms of how the virus has impacted us in the jail, we had to take forth, added precautionary measures. One of our core medical providers is a group called WellPath, and all the medical staff and personnel, we introduced solid quarantine and isolation measures for anyone who would contract the virus so that we didn't spread it amongst our entire facility. We introduced baseline safeguard measures, in compliance with the CDC recommendations for our employees are screened when they come in. We screen those people who must come into custody for major felonies. We put these, disinfection measures in place to make sure everyone's wearing PPE gear. We're cleaning up. Anytime that we can shift our inmate capacity on certain floors and spread them out amongst the cells. For example, we've done that. So if we had, let's say, a site location where it's normally can house 91 beds, but yet at this current time, we only have, 60, the ability of 60 plus people in there. Well, we would take them to another floor, shift them to another side to cut that number down to, let's say, 20. So now we have a separation within those sites. Even with all the progress that we're making, there has been a figure of roughly 33 inmates that tested positive. 33 has tested positive. 20 inmates are currently in custody of that 33. So others are out into the medical centers. 7 total have come back or are negative and still remain in custody. We ended up releasing 5 that was associated with COVID-19. And we had 1 who died from COVID-19, but they died in the care and custody of the medical institute. So I think the things we need to continue to do, Chev and the panel right now, is to really keep the inmate population down. I like to see that number drop and continue to drop, because the more people we have in custody, the more likely we are to impact those who have not exhibited any signs of that 2,741 or so. And then just to make sure we are sticking with our protocols, with our personal protection equipment, making sure our staff have enough items so that they continue to rotate and make sure the place stay very sanitary. With that, I'll turn it over and see what any insight, any comments, any suggestions on, things that you all think we can do better.
Absolutely. And Sheriff, I know we're going to get to that point to definitely speak on that. I want to speak with Chelsea and Desmond on something that you made mention of, and that is the individuals who are incarcerated here. And here's the $1 million question for Chelsea and to Desmond. For a population of individuals who we so often don't talk about within our jails, that's our elderly in our city. The question is, do they need to be incarcerated, locked up, especially in the time frame right now? Chelsea and Desmond, I'll let y'all take that because that's veering right off from what the sheriff is speaking.
Can I give them some intel first and
Go ahead,
help them formulate a good response on that? So one of the things from the state level and what we saw at the CDC, we knew that early on that the elderly population had a higher probability to contract this virus, and therefore they were much more susceptible, and they were going to be part of that group we needed to monitor. I ended up having our Department of Detention colonel, who heads up the entire jail, pull those figures early March so I can take a peek at them. And I think at the time, there was probably roughly 60, 65 or so inmates that were in custody, actually 45 inmates that were in custody that fell in that bracket of 65 years or elder. And then we start looking at the crime patterns in terms of what they were in possession in. And the majority of them had offenses that were severe enough to where, you're talking about major felonies and things of that nature, that when I looked at it, I was concerned about more of a public safety hazard. And so, you know, a lot of those, the 45, if not the majority that fell in that bracket, Shevrin, they're still in custody right now. So, you know, with that, yeah, and just try to give you as much intel as I can.
Appreciate that, Sheriff. Chelsea and Desmond, or Desmond.
Well, okay, I could definitely go first. So, first of all, you know, one of the things that we especially when you talk about pre-existing conditions, it's not only prevalent among the elderly that's incarcerated. The incarcerated population as a whole,
that's right,
has a much higher rate of pre-existing conditions than the general population. In some cases, 3 to 4 times as high as rate. So whether it's diabetes, whether it's heart conditions, those type of things are really prevalent in our jails and our prisons. And I think that what's so important to note is that one of the things that we said from the onset is because of the proximity that people are forced to live with each other, whether they're in cells or whether they're in open bay areas, that prisons and jails is a hotbed for this virus to spread. And we know that if our officials or people that are in charge of our prisons and jails does not take bold and courageous initiatives, that our prisons could actually, jails could actually turn into a morgue. And this is actually played itself out even in North Florida at Blackwater Correctional Facility, where that facility is in Santa Rosa County, and the inmates account for less than 1% of Santa Rosa's population, but over 70% of the COVID death coming from that prison itself, right? And then when we look at the hard data that Florida Department of Corrections has put out, where they have tested less than 1% of the 94 people who are, and out of the 1% that they tested, that almost half of those individuals came back with a positive result for COVID-19. And so if 1%, if 50% of just that 1% that's tested is coming back positive, then I shudder to think about what those numbers would look like with the remaining 94,500 people. That same concern is also translated into our jails in our communities. Dade, Broward, Palm Beach, where we see in Dade, all of a sudden now it's being revealed that over 300 inmates in Dade County jails came back with a positive on COVID-19. And so, yes, we may be testing some people, but it's not enough tests that's being done. But as it relates to the elderly, or as it relates to people with pre-existing conditions, especially in the context of a jail, where we have to understand that there's a lot of people in our jails that's not even convicted yet. And so people are facing a death sentence all because they're too poor to afford bail, right? People are facing a death sentence that might be there for a misdemeanor or a low-level felony, right? But they're facing a death penalty. People are there in our jails that's serving 365 or less, that's facing a death penalty. And so it's more than just the elderly that we need to look at as far as removing them from these type of conditions, right? And I understand that there's a public safety argument there, but at the end of the day, a lot of these people have 30 days, 60 days remaining. What is that big of a difference to where we cannot allow these people to get out of these horrible conditions? As a matter of fact, you see my background now, I'm in a bus. I'm in our Amendment 4 tour bus because we had to drive down from Orlando, Florida, all the way to Broward County because we seen a news article about inmates in Broward County Jail scrubbing floors with soda water and some other kind of concoction and wearing used masks. And so we brought over 3,000 masks and delivered them to the main jail because we know that jail conditions are not conducive to healthy lifestyles. We know that as long as our people, our brothers and sisters are trapped in these cages and can't move and can't get away and they're forced to be in this environment, it not only threatens them, but here's the thing, Rep. Jones, it threatens the community. It threatens the guards that are tasked with their custody and control. Because now these same guards can contract COVID-19, and we just heard the sheriff talk about one of their own just passed away, these same guards could take it and bring it back to their families, to their communities. And 95% of the people who are incarcerated are going to be released into our communities. And so we could try as hard as we want to flatten the curve out in the community. If we're not being aggressive in our prisons and jails, then it's going to be a bunch of people that's going to be released right back into the communities that just recovered from this and create another spike in COVID-19 infections. And so we got to go beyond just the elderly. That's the easy way out. Let's really take a hard look at who are in our jails and prisons. Many of them, because they're just too poor to be somewhere else, because, you know, if they was rich and white, they probably wouldn't be there. But the majority of the people in our jails right now are people of color. And so the economic piece of it plays a major role. And we need to remove that economic piece and understand that a lot of these people that are incarcerated could be at home with their families, could be even contributing to our society in some type of way, other than staying in those jails, waiting on COVID to hit them. And when it does, somebody got to pay that medical bill. Ain't them.
Okay, so Devin, I'm gonna come back because I had another question for you and Chelsea, but I want to go to Dr. Watson really quick because there's another population of these of individuals who we need to speak on, and that is our young people who are in our jails. We have to come back to that point because we have to give the opportunity to make sure everything is cleared up when it comes to what's happening inside the jails. Dr. Watson, as far as our young people who are in our prisons.
Right. Well, I want to first off thank Desmond for those thoughtful comments and piggyback. Like you said, there are many people of color in prisons, primarily Black, brown, and poor. And I can assume that the prison population of young people looks just like that. And Sheriff, I was really excited to hear that the incarceration rates in Broward County are at a record low. What I'm wondering is, how can we build on this? Meaning, let's look at the young people who are in juvenile detention centers for matters, not for anything per se, but for offenses that they can't be redeemed from. Meaning, why not take this time to let these young people come home and get reacclimated into the community so they can truly be safe at home? We know that these prisons aren't safe. We know that our young people are disproportionately incarcerated. Why can't we see a silver lining in this and grant some of them mercy and let them come home to be with their families and to be safe and to help rebuild our communities? Because we need them at home. And it's obvious that prison is not doing a good job with them based on the recidivism rates. So is that a likelihood? Is that being talked about?
Yeah, there's a couple of things you said, Doctor, there that was actually good. And I agree with your sentiments, and I've shared this with my command staff, in that why does it take a pandemic to have a reduced jail population down to 64%? Why is it that we have to take on a major consideration from the law enforcement practices in the field to say this time here, someone doesn't need to go into jail? Let's give them a citation. So when I look at that figure and it comes across my desk and it has been continued to reduce, it was like it's 70, 72% early on, then it dropped to the 68. Now here we are at 64. My thing is, how about we put a strategy together that has long-term sustainability where that number doesn't rise to that point? And here's some things that I would talk about from a strategic standpoint that I've started to look at and do before this pandemic took place, was an educational component, making sure that our men and women who are out in the field have a better understanding and how to communicate day to day and deal with the cultural interactions with minorities, because the overwhelming incarcerated personnel are Black and brown people. We know that. That's no different than any other place here in the state. And so I instituted, and we have a mandatory training that's coming into place, dedicated about $500,000 to start it, which is racial equity and implicit bias training. I know Representative Chev, you've been on that for a long time, trying to get it passed at the state level. Well, here I am. I'm the first Black sheriff here. I understand the hardships that occur in the inner cities. I've survived, home invasions. You all just heard about some of this stuff in the past, and dealt with the crime patterns that are really associated to some other issues that are not being addressed here and not talked about. The fact that, how do we get them back into the homes right now, right? A model of let's release these young people now. Well, where are they going? They're going back right in the communities where they were either in broken homes, there weren't other opportunities for added education to keep them off the streets. These are the things when we start talking about the significant differences between the Black America, Brown America versus our white American counterparts or localized residents, is the opportunities. If you look at the opportunities that exist for those of wealth and typically in our white American populations, their kids have more access to programming such as schools and sports and all these added initiatives to keep them from engaging in getting into gang activity, finding themselves committing crimes that end up being attached to them for a long-term tenure. So I think there can't be just a solution for this current pandemic to say, let's explore the idea of releasing these people because they're young and these offenses are minor, so let's get them all out right now. Well, where are we sending them? We're sending them right back from where they came. So if we're not sending them with tools, if we're not sending them with opportunities, then recidivism rates, which are always higher in the minority population, is going to find itself again. I do have some things that are very familiar with you, doctor, so I can gravitate to much of what you're saying. Is I've been a professor. I've teach this stuff as well when I finished grad school, and I've always looked at the numbers. I've also always looked at the how the economy impacts things, poverty, so on and so forth. So here's my answer to your question. We need to have a comprehensive program that is not minimized by just letting people out of jail right now, but where are they going? How are we going to make sure we keep them out? And what advantages are we going to provide them in terms of tools of education, programming, employment opportunities, et cetera, so that they don't find themselves back in jail?
Yeah, can I ask you, because I actually want to have Chelsea jump in, because you literally, I got it written down right now to ask Chelsea, with all of this happening, and based on what the sheriff just said, based on what Desmond just said, and what Dr. Watson just said, after all of this, where is the state, do you think the state move into post-COVID in our criminal justice system, knowing what's happening now? And then I'm going to go to Rodney with something.
I personally, I think that community supervision is going to be a big thing that we've got to talk about. Besides all of the other great ideas that we've said, the past couple of years now. I think that one of the things to keep in mind that is, just regardless of this pandemic, I don't think that we need to be drastic in some of the decisions we make. I think that public safety is obviously extremely important. And so I think that some of the ones that we've been advocating to be released, we got to be, continuous on our thought process. And I think that, we need to weigh out with risk assessments, those who are a threat to society and those who aren't. And I think that, we really need to be focusing on bail. And, there's a lot of folks that are just sitting in there, who could very well, get out on something. But I think that, we need to be really just kind of weighing out all of our options. And again, going back to risk assessments and community supervision. I mean, where are these folks going? And we want to make sure that everyone has the right environment to succeed and whatever tools they need to get there.
Chef, can I tackle something on the risk assessment? Because that's a very good point in terms of, one of the things that has been pushed forward towards my office is, hey, Sheriff, can we get more people out? We've seen, I believe it was Hillsborough County and a couple others in Northern Florida or Midline Florida that did a process of releasing inmates. And from my understanding, there was no real assessment and risk assessment process that took place to determine which ones would go out. It was more of, hey, these people are in custody for minor crimes, misdemeanors, etc. And they released them out. And then shortly thereafter, unfortunately, Hillsborough County, one of the people that they end up releasing, went out and going out and commit a murder. So there can't be just a single based process of examining someone's criminal history exclusively. Some we can say, yeah, this one's worth the risk of letting go and moving on and out of here. But there's also behavioral patterns from a psychological standpoint as to, what are these people, or these young men, or these elderly populace inmates, what is the propensity for them to more than likely commit a crime, and what type of crime are we looking at if we're going to be subject to accountability? Because the other side to it is, if I release somebody and they decide to go back into criminality, then it is my law enforcement personnel that are now going to be at risk to bring them back into care and custody. So the reason why I expand on that is because I want you all to know, from every single chair that people are sitting in, I look at every angle and I'm looking for some partnership to give me some good solutions.
I appreciate that, Sheriff. And Desmond, give me 2 seconds. I knew you were about to say something, Desmond. Hold on. Don't. I know it.
Desmond's hand went up soon when I said something.
Desmond, give me 1 second. Let me. I know.
Right. I'm just saying, it's what we call back in the day the burning desire.
Okay. I got. You said I know.
Here's the thing: we can engage. All right, we can engage in this conversation, right? And like I said, this is not attacking anyone or whatever, right? But hear me out. We can engage in these conversations all day. These type of conversations and these steps that we're talking about fixing the criminal justice system is not new, right? And insanity is doing the same thing over again, expecting different results. It's time for new results. And so there's two prongs to this. Number one, when you talk about I love the fact that the sheriff want to have implicit racial bias training for his officers. But let me tell you, if I want to learn to be a better quarterback, I don't go and talk to Cal Ripken, right? I go talk to Joe Montana, or I go talk to Tom Brady. And so it's critical about who are these people that's actually doing the training on implicit racial bias, and how are we integrating that training with grassroots organizations in the community for years who've been doing a work around racial discrimination and biases, but doing a lot of racial justice work, because there are plenty of them here, especially in South Florida, but throughout the country, that's been doing this for 10, 15, 20 years. They need to be a part of those trainings, they actually need to lead those trainings. And then the other prong to that is that they got to be a level of accountability and transparency. And so that means, how are you willing to really welcome the community into this entire process, right? And to be vulnerable to the community, to where we can work collectively together to make sure that these recommendations or these new norms that's coming from these trainings are actually implemented and enforced, because it has to be enforced. The FBI has a great cyber terrorist squad. You know why? One of the main people who they hire, right, to fight cyber crime are people who used to commit cyber crime. And so that means that the people closest to the pain are often the one that's closest to the solution. So how are we bringing the community and return citizens into the conversation?
Sheriff, Sheriff, I'm gonna come back to you really quick. So because I want to get Rodney real quick, because Desmond, you made mention of something that I think is important that we speak of, and that is who we are arresting and who we are incarcerating as far as when it comes to implicit bias. And so, Rodney, when it comes to implicit bias, is something that you've been dealing with and something that you've been advocating for in the age of COVID right now. And Sheriff, you're gonna see this because I asked this on our delegation call, and that is to you, Rodney. What do we need to do, or what do police departments need to do to ensure that the enforcement that's coming down the pipeline, from the 6 feet to the mask, to ensure that they are not over-policing and not making false arrests on individuals just because now this is a new rule that's on the book, because it's happening, where individuals are being arrested for these type of offenses.
Most definitely, Chef. I think you hit the nail on the head with this. We don't want to criminalize being sick. Essentially, we don't want people being thrown out of locations because they refuse to wear a mask, or maybe they don't have access to a mask, or maybe they're doing physical activities, so the rules say that they don't have to use a mask. When we reopen, because it's inevitably going to happen, there's going to be rules that govern certain areas that don't govern the other areas. And when police departments don't coordinate what that rule of law looks like, it will undoubtedly put people in harm's way if they refuse to listen to a police officer. I think we have to be very tactful on how we utilize this space, because oftentimes the American criminal justice system has shown us where there are people that are disenfranchised who will criminalize everything that they are and throw them in jail. We've seen it with homeless people who have tried to just put up tents to give them the desire to live. We've seen it with people of low economic status, and hopefully we don't see it here post-COVID, of people that may be sick, may not be sick, may just be outside living in space, and now all of a sudden they're committing a criminal offense. One thing about Florida, and maybe Dr. Watson can relate to this too from being from the Northeast, I call Florida felony Florida. Everything is a felony and there's no in-betweens. So, you know, you could be on a jet ski on the ocean, all of a sudden you go 2 miles over the speed limit, oh, there's a felony, you could ruin someone's life or career. So we need to be careful in not criminalizing being sick. To add to the second part of your question, what does it mean to have implicit bias training or insight in a police department? And this is something that you said, Chev, that I deal with every day. We have to be careful in what that means and what does that look like for our police departments. I think oftentimes us as community members, we want implicit bias training for our officers, but we don't want it in a way that it's more like charm school. Oftentimes I deal with police officers when we know, listen, 2 + 2 = 5. I mean, 2 + 2 = 4, but you keep saying it equals 5. You don't need more training. Like, wrong is wrong and right is right. More training sometimes isn't the right answer if the real answer is someone just needs to be relieved from duty. So we have to be certain on who receives the training, if the training does exist, and being deliberate in giving that training that is for practical and pragmatic reasons. The sheriff can probably tell you that during the academy time and in-service training, there's not a lot of time that goes around that gives officers time to actually do training. At most, you may get 1 hour block of implicit bias training your whole year on the force. Now that 1 hour, more than likely, isn't going to train your biases. And most police officers will probably say that we try to mitigate the stereotype threat. So they don't even want to go in saying this is implicit bias training because maybe they feel as though officers think this is like the boogeyman and you won't be receptive to the kind of training. So there's just various schools of thought on how implicit bias training should work and shouldn't. I think that if you are trying to institute implicit bias training during someone's career or thereafter, you're probably way too far off the ball. You need to have better pre-screening measures in order to understand and identify where people have racial bias when they are in the department through their counseling and thereon afterwards. Each year, there should be additional checkups for psychological evaluations to determine if someone does have a bias. And it could be more than just racial. It could be towards women. They could have domestic issues in their families. A lot of times these red flags can be caught. And oftentimes they do fall through the cracks because of the various reasons our police department is set up. I say we figure out where those cracks are and we use pragmatic and practical solutions to weed those people out of the police force because they shouldn't have the honor of wearing the uniform. And I think we all can agree that it all starts with policing, Chev. It all starts with policing. If you can avoid that first arrest for a person that from a cop that just wanted to go rogue or had a bad day or just is crime ridden, we can change the trajectory of everyone's life. And, you know, and being in the legal sector myself, oftentimes say, if it took us to get to the courthouse, we failed ourselves because we could have stopped. We could have stopped that person that probably destroyed their lives because a police officer had a bad day. So there's plenty of things that we can do. Obviously, Chev, you know it from the legislative position. If we write good statutes that have good precedent and good implementation, we can change it on paper. And police officers can change it on their day-to-day patrols. But if it gets to the courts, we probably already missed our point. So it takes good training, but we can't train away all of our issues. Sometimes, you know, if it's rotten, you got to throw it out.
Rodney, so you just said something I know Dr. Watson, she has worked on and she's worked on for years, and that's implicit bias. Then I have a question for Chelsea and the sheriff. Dr. Watson, implicit bias training.
You on mute, doctor.
Doctor, you on mute?
Sure. I want to begin by, well, first off, Rodney, I totally agree with everything you're saying. But I'd like to begin by troubling the word implicit bias. And because we are in Florida, right? We know what it is. It's racism. It's anti-Blackness. It's targeted policing. It's the behaviors of law enforcement agencies throughout the nation is criminal. And who they persecute is personal, is prejudiced, is biased. So if we're really going to be honest about reimagining, you know, this post-coronavirus life and how we can improve our communities, even when we do, let's say, the risk assessment, who are you assessing for risk? Really, it's us who are at risk if you think about what plagues us. And it's not just the disease. If it's not the disease, it's the cops. If it's not the cop, it's the policy and how it's carried out and the lack of transparency and who these policies unintendedly persecute. Many would argue it's part of the plan. So my point is, instead of doing a risk assessment, why not do a community investment and look at the communities to which these young people who are committing these crimes come from and figure out why. It's not just what happens, it's why it happens. Look at the opportunities that we don't afford them. Look at the grace that we don't afford them. Look at how we treat them. But yet we want to be, our laws abided by, we want to be respected, yet you want to hold them accountable when you don't even hold, unfortunately, many police officers are not held accountable for what they do and don't do. I've never yet, well, few and far between have been prosecuted for the death of unarmed Black men, women, and children, especially in the state of Florida. So if we're going to be serious about reimagining policing in Florida, well, who's policing the police? Because that's who scares me. I don't really mind the quote unquote criminals coming home. I know them. I grew up with them. It's these cops in our communities who I don't know and who I know they don't love me. So I'm asking you, what can we do to bring back that?
Chelsea, listen. So
Can I get on this, Shelley?
You could be honest.
We're gonna have to have a round two for that one.
Yeah, I gotta get on it. I gotta get in on this because
I know you do. And you go ahead and
she
take
just took us.
Chelsea, I got you got to get on that, Chelsea. Go ahead, Cheryl.
She took us to church on that one. I got to get in on there.
Yeah.
And look, here's the thing. There's a multitude of responses that I'm going to add in because we're speaking on a more larger scale now. We're talking about state issues. I'm talking about Broward County and what I'm able to do here as the sheriff. There was discussion about the importance, Desmond had it, the importance to make sure if we are going to institute racial equity and implicit bias training that is done by the subject matter experts, that the police is not creating their own curriculum. That's why I've contracted this entire process out and dedicated over $500,000 to experts who are doing this at the county. The implicit bias training program that we're instituting, we've partnered up with the county where REI and some other groups are coming in and we're taking their curriculum and instituting it into our organization where I've made it a mandatory policy that every single deputy goes through it, not once, that like it was mentioned in the academy, because it's not enough. You get an hour, it's not enough, but it is now an annual process. The second side of it, what we've heard from the experts and how they traditionally do this racial equity and implicit bias training is to include the community in that training. And that it's not just officers in a room being trained, but there's young Black men who they probably never been around. There's young older Black women that they probably never been around. And so we diversify this training and have it inclusive because we are part of this community. And it's one thing to read something in a textbook, and then there's another thing to hear from somebody's mouth about how they feel and what the things that they're going through from a cultural standpoint. So we're already in that phase. This is not a BSO exclusive program that we're running. This is part of what the experts are saying we need to have, and we're going to institute it and make sure it's a mandatory program. The second side that was mentioned in terms of, all right, how are we going to make sure we hold people accountable and transparent? When I came into this organization, we had a very, very poor process in terms of professional standards committee, which was designed to have both law enforcement and civilians sit on this board and objectively examine the actions of my deputies and then provide a recommendation for action. And within the first 6 or 7 months of me being in command of this organization, it had become evidently clear that that committee and the personnel that were on there had been put in a position where a blue wall was created. We had circumstances where deputies had failed to go into a school and 17 people died and I had to fire them. And I caught union backlash on that, saying it was unpopular. But it was recommendations for a slap on the wrist. We had an individual, a deputy, strike a man in the handcuffs. That same professional standards committee had said, let's give him another slap on the wrist. I had to fire him. We had an incident where a deputy slammed a white 14-year-old, 85-pound girl down into the ground, and I had to suspend him. We had a national, if not a global incident take place where a Black young man face was slammed into the ground.
Yes.
And that same professional standards committee had recommended that he be exonerated, and I terminated that employee. So in terms of what else are we doing to make sure that things are accountable and we're being much more transparent, I committed to this community that when we know, the community will know. There's no need for us to wait for body-worn camera footage to come in. There's no need for us to wait for an iPhone video footage to come in. We've restructured this professional standards committee where I've diversified it unlike it has ever been. We now have both Black and brown people that are accomplished in employment law. They've acted and served in the capacity of U.S. Attorney Generals, labor management, and many other positions who are now not just sitting on this professional standards committee, but they are educated enough, they are articulate enough to look at what agency policy says, along with response to resistance, and then come to an understanding about the legality of the actions of what they should and should not recommend our actions to be done. So I understand. I have said this time and time again, and I think I am very much qualified to say this, in that, yes, I've been the sheriff in this office for roughly 15 months, but I've been Black in this country for 41 years. And long before I had stars around my neck, I had a dirty racist cop putting his knee upon my neck. I've had to survive home invasions. I've watched a multitude of friends being killed in front of me. And I understand how poverty and drugs impact the Black and brown community. So I'm excited to hear of everything that came up, but understand the majority of what was mentioned, I've already started. I'm looking at how do we expand it? How do we become a case study here in Broward County for the rest of the state of Florida?
Yes.
And if I can, I totally agree. I think it's great that you are doing all these things. And I think, quite frankly, I think there are a lot of sheriffs that are doing the right thing, but I also think that there are some folks that are not, just like there's some bad players in every aspect. And so I think that coming from a uniform approach is really important. And yes, I don't disagree that, you know, we have some extreme racial disparities and a lot of different things going on in different counties and how that kind of crosses over. And that's an issue and that needs to be dealt with. But I think at the same time, I think that we need to be, you know, the fact that somebody can get out in one county and then in another county, they're going to be locked up for that or for the inability to pay. I think that that's, we've got to have some sort of transparency and consistency here in Florida.
There's some questions that came in really quick. We have about 15 minutes left, so I want to get at least 2 questions in. One of the questions that came in from Easton Harrison from the sheriff said, are we currently testing within Broward's jail? And if so, do you think there is enough testing taking place?
We have, look, the testing issues are saying that we're dealing out in the community. We test those that have exhibit the signs, but for us to introduce 2,741 test kits, if we were provided access to that volume of test kits and we can get it in there, then of course it would make sense to do it. But the reality of it is it's not a matter of cost, it's a matter of the supply and demand. Right now, we can't even get the supplies. You heard the same argument when we talk about our ability to have in walk-up test sites in more predominantly Black and brown communities. And we had the one established here with the Urban League, but we need more of them. But the issue will continue to be is that unfortunately, as a country, and this is somewhat me lecturing on a national level, is that we have provided on so many outsourced elements for equipment. You talk about personal protection equipment, N95 masks built in China, KN95 masks built in China, the test kits built in China. What's built in America? What's built here to make things much more accessible so that when we run into a worldwide pandemic, we are not relying on another country thousands of miles away to dictate what we do here in Broward County and the pace of how we can do it. So there's a lot of complexity behind that question, but I think if we had the ability, I wouldn't be opposed to it.
Hey, Sheriff, I got to hook up on some masks, man. So maybe
thank you for sending. You said 3,000. Let me give you a shout out. The man sent 3,000 masks over to the jail for the inmates. They have them. Love you for that. Thank you for that. And we'll do all that.
And Sheriff, he drove from Orlando to bring those masks today. So
all right.
Rodney, you had your hand raised, and then I'm gonna go over to Chelsea and to Desmond. Go ahead, Rodney.
Yeah, I just wanted to comment on some things that Sheriff had mentioned, and also the piggyback off what Dr. Watson said about who polices the police. I didn't get into, I guess, as much in the initial introduction about what I do day to day, but I work in a civilian oversight department here at the city of Miami, where we have an independent investigatory model for investigating police officers involved in misconduct. Our department is separate and apart from the police department internal affairs, and we do really great work in trying to hold police officers accountable. Obviously, there's some carve-outs and protections with Statute 119, things like that. But one thing I will say, Sheriff, I think I commend that you did a good job trying to navigate that situation. We were watching it closely down here in Miami-Dade County after the review board, which you have accurately put, almost like a big blue wall of people were a part of that. They were almost aligned with the police department. It wasn't necessarily their own independent community office with great professionals that allowed them to do great things. I know since you've since restaffed it, and that was great. But one thing that I always know is that these types of boards that do oversight of police, they don't necessarily survive forever or on their own merit unless they've been insulated and independent. And as you know, none of us are going to stay in these capacities forever. We're hopefully all of us go off to do bigger and better things. But I guess I have a question as well for you, Sheriff.
Sure.
What have you done, or what will you continue to do to ensure that that department, if not already, remains as independent as possible with resources and opportunities to truly hold police accountable? Because although you have restaffed it with great minds and good people, if they don't have the resources, if they don't have the money, if they aren't considered independent or maybe even part of the county charter, they won't be effective.
Well, I can tell you from a financial standpoint for the Professional Standards Committee, the money aspect isn't a concern for us in terms of how it operates, right? We have almost $1 billion operating budget. The people that I have hand-selected and interviewed, by the way, that's something that speaks to what you're talking about. Traditionally, the Professional Standards Committee, at least for my predecessors and sheriffs before me, they didn't go out and interview every single person. I am, along with my command staff. They didn't put them through a series of, questions related to their morality, their ethics, and are they willing to stand up? They didn't have a desire to have people who had high-level degrees and was attorneys that could be challenging the law enforcement officers in the room. Because if you're going to have real dialogue and real clear understanding, you have to be able to challenge people. And we had a set of circumstances where the union representation would dominate these rooms. Well, the union is designed exclusively to protect the men and women. Their job isn't to be, objective in a sense of, if we're wrong, I'm going to stand in front of a camera and say I'm wrong. That's an administrative responsibility. So we went through the selection process and been much more vigorous. Now, as each sheriff comes in, to your point, they're capable of changing it. They're capable of going backwards. And so it's important not to just establish it now, but for the community out there to make sure they keep putting the right people in this office. I got called in and accepted a job and had a good interview, and I'm here. But this is up to Broward County to choose who's in here. The second side of it is this. I have to be fair in that now that I've reestablished a new board, I hired an honorable judge to be the chairman of our Professional Standards Committee, a minority, and I put him in this post. I have to give this time to see how it manifests. Are we much more just in our process? Right now, we don't have any IA cases that are active and going because of this pandemic, so we slowed things down. We've told our cases, but trust me, I'm going to be closely monitoring. And if we can't get it right with the level of people and the quality of people that I put in here, then I'm going to have to start entertaining the idea of maybe this goes to a full civilian board that's outside. And I can tell you, law enforcement, that is not popular. No one wants to hear that. I can tell you, just any deputies or law enforcement officers or the union president or so who's probably watching this, they just cringed when I said that if this doesn't work, that will be a next step to be considered. But that's the reality. You can't say that you're going to be accountable and transparent when people can't see in. If you're only looking out and determining what you show people, that's not transparency. And so we need to make sure we have that level of trust with the community. When something goes bad, we're not masquerading and hiding things and giving people a slap on the wrist. And I'll leave with this one. Not everything's a matter of you have to be a use of force expert. Not everything's a matter of you need to be a cop. Much of this comes down between what's right and what's wrong. What's decent? What do you expect? Right? Every single application of force that we consider comes down to this. Was it reasonable, necessary, and proportion to the threat that they were dealing with? It's not a 30-page item. That comes back to decency. So I appreciate your question, and it's not lost. I understand I have to pay attention to this.
I appreciate that, Sheriff. So we have 10 minutes left. And listen, you guys are good. This is a very good conversation. And yeah, and anybody who can maintain the audience that's watching, that's a good thing to have right now. I do want to look at Chelsea and to Desmond. We're having this conversation in the last 10 minutes that we have, and then we'll close out. I'm asking each of you a different type of question, but to two of you, your ideal world when it comes to criminal justice reform. What does that look like? Either one of y'all can take it.
Chelsea, go ahead. I'll follow you.
Go ahead and do it real quick. I hear my kids screaming outside the door. My husband took the piece for a walk. So I think my ideal world is one where, we're keeping the public safe at the end of the day. I think that we need to really be restoring families. I think that restoring families is one of the things that we're really needing to do in order to bring down and have some good results. And so, yes, I think lowering the incarceration rate is important. But I think that also making sure that we're getting folks the types of resources they need, the types of programming they need to be successful. So I think it's there's not a silver bullet. I think it's a holistic approach. And I think we're going to need everybody on here and a heck of a lot more people to see that through.
Thanks, Chelsea. Desmond.
So when I think about that ideal world, what I think about is a world in which my skin color does not arouse suspicion, right? First and foremost. Second of all, I think my economic status did not determine the level of justice that I receive, whether I am a perpetrator or even a victim of a crime, right? And then I think the other part is when you talk about an ideal world is that in spite of the fact that I may be incarcerated, that does not diminish my level of humanity. I think that a nation is judged by how it treats the weakest among us. If we're talking about building a great community, if we're talking about building a great state and a great nation, then the majority of our investments must be in the most vulnerable of our population, must be in the weakest among us to strengthen us. Because if we're doing anything other than that, that's like we're in a boat and there's a whole bunch of holes at the bottom of the boat, but everybody want to pay attention to plugging the holes at the top of the boat, right? And not at the bottom of the boat. And eventually that boat is going to sink. And I think that even when we look at it from the perspective of COVID-19, if we are not testing people who are incarcerated, increasing the level of testing there, if we're not providing protection for officers and inmates, what's going to happen is not only will we end up running the risk of reinfecting our communities when people are released or officers are going home, but the fallback from these individuals contracting COVID-19 will put an enormous burden on our healthcare system, right? That somebody's going to have to pay, and the taxpayers is going to have to shoulder that burden, right? And it's going to also hurt us economically. So at the end of the day, I think that the ideal world that I'm living in is a world where we're able to actually connect with each other and deal with each other along the lines of humanity and not let the color of our skin or our economic status or our sexual identity or even our immigration status determine how we're being treated, right? Because whether or not I'm documented or not, that doesn't mean I'm less than a human being. That doesn't mean that I love my child less or that I deserve to be separated from my loved ones or my child. Just because I'm transgender, that don't mean that I should be exposed to danger or ridicule or prejudices. I am still a human being first. And that is the ideal world. Will we ever get there? I guess when we get to heaven. But look, we could try our best, our damnedest to make sure. And what I challenge my people out there, people that are looking at this right now, who are returning citizens or who have family members that have been impacted by the criminal justice system, I can tell you right now that our time has come. Amendment 4, when we passed in 2018, we created this environment where our time has come. Right now, it's our vote, our voice right now that we can make a difference. We got sheriff races going on. We got state attorney races going on. We got judicial races going on. And let me tell you, based on testimony in the lawsuit, There's over 85,000 returning citizens already registered now, right? And as Florida goes, so does the rest of the country. And so guess what? We cover the gap, y'all. Our time is now. We can make our voices heard, and we can change these conditions that we know need changing, and start forcing folks to start treating us and treating others with dignity and respect and love.
Yeah, man, I felt that in my soul. Terri, I'll go around and ask that question, and we'll end with you, Sheriff, because there are some individuals who have family members in the jail who they have 2 questions to ask you. And Terri, ideal criminal justice world. You're on mute.
Yep, I just took it off. I'm going to be radical with my approach, and I really like what Desmond said about recognizing one's individual and collective humanity. And I was really excited that Sheriff Tony said that the rates of incarceration in Broward County are going down. But what I'd like even more so is that we abolished prisons. I think that beginning with the nation's original charter, we knew why and for whom prisons were created. We know who we impact when we incarcerate young men, young women, and children. We know that prisons make some people very wealthy and that they have annihilated generations of people. So knowing what we know, if we're to really move forward in a meaningful way, why not eradicate prisons? Why not give people the resources that they need to be successful? We know that most crimes are committed out of need for something. So why can't we invest in people, invest in communities, and invest in our tomorrow and think about abolishing prisons altogether? That's what I'd like to leave you with, and have us really think deeply about, why do we need prisons and who are they for?
Wow.
That's the real question.
Wow. Thanks, Dr. Watson. Rodney.
Yes. So for me, the ideal criminal justice situation in America really hinges back to policing. Everything, like I said, starts with policing. Really reimagining policing not being patrolling, but what does safety look like? You know, if we had more conversations on how to protect our communities from a safety aspect versus a policing and handcuffing aspect, we would get a lot more things done. Typically, we always have the conversation that there's too many Black and brown people that are arrested because they come from horrible economic systems, communities that are over-policed and underserved. But at the end of the day, the most money in every budget, whether they be federal or in local, go to our police departments or our military. And more police are patrolling in our communities of color than any other place. So what does that tell you? It tells you from a systematic perspective that the most coveted, the most resourced, the most expensive thing is in Black communities. If we could redistribute that money into these communities, instead of having the most expensive police car, not saying that we don't need things to protect our police, or having the coolest new tools in order to do policing, and use that thing to build up, or use that money instead to build up our schools, to build up the way that we educate our children, to ensure that people have affordable housing or food, that would totally change how we conduct ourselves in the modern day society. I think far too often we're looking at solving all of our issues with policing and law through criminal justice, and we should look at it in more of a lens of, what does this mean for public health? What does this mean for city resiliency? What does this mean for safety in our communities? And if we look at it through those lenses and funnel money through those aspects and those envisions, we get better things from it. But far too often, we throw it into policing. We make policing solve everything in our communities, from our teaching. We see it now more and more with school shootings. Let's put police in schools. Let's delegate our responsibility from teachers to teach, or to maybe solve minor disciplinary issues, to now arrest children, right? So the more we throw police at our issues, instead of hitting them head on with resources, criminal justice, it won't even matter. We have to look at these things from a healthcare aspect. We have to look at it from a safety aspect. And if we do that, our cities will be more resilient.
Thank you. I appreciate that. Sheriff, we're going to do, well, and we're way over time, but I mean, we've been able to maintain an audience. But Sheriff, we'll end with you. And I want you, one of the individuals want you to address family members who desire to visit, they consider that they can't come visit their families, the outlook on being able to make free phone calls so they can contact their family members. If you can address that in your roundup.
Sure. A couple things we do have in place. It sounds like they don't realize we have the online visitation program that we've established. They can go onto our sheriff webpage, sheriff.org, and pull up all the information to go about doing that. If there's an issue where someone just doesn't have the online capability, things like that, here's what I will promise to those callers. I'm going to talk to the colonel and look at what that call intake looked like and the volume. If there's a way that it makes responsible sense where it doesn't put a financial burden on us and we can waive some of these things to be helpful during this time, then that's something I'd be receptive to. But it's got to make sense. I don't want to burden another system by using funds or taking money from other areas. And you said there was a second question, Shevrin?
So the second question was about transparency in the numbers that's being reported as pertains to the amount of cases that's in the jail.
Yeah, everything's public record. Look, if you call for it, you'll get it. One, by law. Two, because I believe in transparency. And I don't walk into a room unless I know how to walk out of it. And I've had all the stats and stuff printed here in front of me so I can give you the most accurate accounts based on today's date. And I'll just recap them for the personnel that's on here. In terms of our jail population, we currently have 2,741 in custody. That means we're at 64.1% capacity. That means there's a total of 4,276 beds that are allocated amongst our jails. And if I have a chance to close with a comment, I'll close with this. You're talking about an ideal world and an ideal criminal justice system, and that's a complex question that has a lot of varying parts to it. And I would say the first part is we need to make sure that we have a much more fair and equitable process within economic development in our cities and in those minority communities where it's hard to create businesses. It's hard to have the same level of education to compete in the overall dominating white society in terms of this country. So that's not new. We've been echoing that for years. The second side of it is if we are able to fix that part of the problem, that'll reduce our interactions in a negative aspect with law enforcement. But not doing that, we still have to understand statistically that roughly 70+% of our patrol capacity or so, and I'll just make sure to see a number, some food for thought. We have 1,400, for example, in one particular year, 1,400 different law enforcement officers of that. 238 of them are Black. And yet the majority that are patrolling our 15+ cities or so that we have here are in the inner cities. They're not reflective of the community. They don't understand the culture. And so we are already behind there. And I've tried to fix this and mitigate this to create a much more diverse recruiting practice, bringing in more minorities, giving them the opportunities where it has not always been equal. I am very transparent about saying this. When I looked at the recruitment numbers and figures, we had applicants who would apply, a Black man in this case, who would apply for a job and he was arrested as a juvenile for 2.2 grams of marijuana. You take our white counterparts, our white brothers and sisters, they would get the job. How could you say that that's a fair and equitable process of employment? And how are you going to be able to say that the public should trust us? So we had to re-ramp and rechange and go back and even give people opportunities when we seen this. And some of them are out here patrolling these streets now. So when we're talking about change, change so often will come from the top. The people who have the power to make decisions, they're the ones that are going to be the influence and implement policy and implement all these things that impact the community. So it was said earlier, you have to put people in leadership capacities that understand these issues and not only talk about them, but when they're in position to do the job. Do the job and don't fall back on excuses. Don't fall back on the inability to have the moral courage to speak the truth. I think people want to hear the truth. And if you can't face it, if you dance around it, if you're not willing to say, hey, this is broken, and I'm a sheriff who is saying that this criminal justice system is broken and we got a lot of repairing to do, I need to hear more of that. And it doesn't need to come from just a Black sheriff. It need to come from any sheriff that recognizes these same problems in their county.
Thank you. I really appreciate that, Sheriff. And listen to Dr. Watson, Chelsea, Sheriff, Rodney. Thank you all so much for doing this. It's really it's just really good to be able to have this conversation. And I know we all not going to agree on everything. And I don't think no one wants to live in a world where we agree on 100% of anything, because that creates a boring world to live in. But being able to have this conversation, especially around criminal justice, it's a big deal. There are some questions that have come in that I will send to each of you, that you can reach out to these individuals separately to get. But I appreciate you all for your advocacy and for your leadership in so many areas. Thank you all so much. I really appreciate it.
Thank you, Senator.
Thank you. Stay safe.
Hey, thanks, Chef. Appreciate you having me.
Appreciate y'all. All right. Thank you.